I'd like to begin by acknowledging the traditional custodians of lands that we're meeting today. I'm speaking from the Whadjuk lands of the Noongar Nation. I want to pay my respects to elders past, present and emerging. I want to acknowledge their custodianship of the land and waters and acknowledge that these lands have never been ceded. And I want to particularly pay my respects and a very warm welcome to any First Nation people who are joining us today. Subject we're going to be talking about this afternoon is futures and foresights methods. And I think just as a few words of introduction, in the EU today, conducting a foresights exercise is explicitly recognised as an important part of good governance in the policy formation process. And I think this reflects a growing recognition, perhaps over the last decade, and definitely accelerated by events like the COVID pandemic and the war in Ukraine, that we live in an increasingly uncertain world. We're going through a period of rapid technological and demographic change, and increasingly the feeling that past events may no longer be such a good predictor of the future as they once were. And this has resulted in a toolbox of different methods and approaches being developed and increasingly commonly used, certainly within the EU, with the objective of making policy and practice more resilient and better prepared to possible future events. And we're going to hear a little bit about some of those here today. And we're going to be looking at the areas of communicable disease and the illicit drugs area, but these methods are common across, I think, most policy areas now at the EU level. I'm also delighted to welcome and have with us Professor Alison Ritter, good friend and director of the Drug Policy Modelling Programme at the University of New South Wales. And we're going to ask Alison to reflect and lead us a little bit in a discussion at the end of the meeting on any lessons that could be learned or implications of this work that might be relevant to the Australian context. And just one last thing I think I have to say as a word of introduction before we start. I think it's often misunderstood that when we talk about approaches in terms of futures and foresights, we're not really focusing on trying to predict the future with any sort of precision. Rather, it's all about acknowledging uncertainty and trying to ensure the choices we make in the now are more informed by consideration of the range of possible futures we may face in the future, be they good ones or be they less positive ones. So I'm very pleased to join me. Welcome. We have three speakers today. We have Dr. Heron Inking. Sorry, I've been practicing his name, from the ECDC. That's the European Centre for Disease Prevention and Control. That's the sort of European version of CDC in Stockholm. And we have Claudia Palschek from the innovations team at the European Union's Drugs Agency. And we have Brian Gavin, who is head of the Irish National Focal Point and works at the Health Research Board in Ireland. And we're going to kick off with Gerjan, if I can ask you to start sharing the screen. Gerjan is a principal expert in policy coordination, strategy and impact at the ECDC. And he is going to introduce us to how foresights have been used in a public health agency and really present, I think, a strategic foresights initiative using a multi-method approach.
Thank you, Paul.
Gerjan, you have the floor. I'll turn my mic off.
Right, thank you. I hope you can hear me and see the slide well.
Both are perfect, thank you.
Perfect, then I'll kick off. All right, so yes, I'm Gerrit Ekink, working at ECDC, and I was asked to introduce strategic foresight to you, what it is, and how we have used it to try and improve our preparedness and resilience, and that in 12 minutes, so I can already predict that will be tight, but I'll do my best and be prepared that I'll go slightly fast. So these are the public health emergencies that ECDC has been dealing with since our foundation. And when I started Foresight, people were asking me, so you're going to tell us when the next outbreak is going to happen and which pathogen it is. So I had to immediately disappoint a lot of people because Foresight's not about prediction. And also, actually, if we think back about the last 3 years, or 5 years in the meantime, It wasn't necessarily a pathogen and the timing that were most problematic for public health, but it was a lot of other things like misinformation, geopolitics, very high media attention, that COVID as an emergency took several years. So there was fatigue in society and also in public health agencies, polarization in society, stigmatization. And on top of that, a war was started in Europe. We have increasing extreme weather events and already budget cuts in many public health agencies, even during the pandemic. So we had quite some blind spots and also gaps in our preparedness. And luckily, that is the realm of foresight. So I was still considered to be useful. So why are we doing a strategic foresight in public health then? Well, exactly because of these gaps and blind spots. We try to use foresight to become more anticipatory and resilient by applying futures and system thinking, reducing blind spots by looking and collaborating wider outside of our area of expertise and working more interdisciplinary in a participatory way, and then be able to make proactive decisions by prioritizing things we have to focus on and navigating the uncertainties that come our way instead of being stuck by them in decision paralysis and in constant firefighting mode. So what it looks like in our work, I'll use the pointer. Most of our activities are centered around the present, where we're thinking about early warning, surveillance, monitoring. And even though the activities that are a little bit more forward focused, like forecasting, only go a couple of weeks in the future, and scenario simulations maybe months to a few years. So Foresight really tries to take a big step forward, thinking at least 10 years in the future, to then very proactively inform policy options and strategy. So what is strategic foresight then? Well, the European Commission defines it as not being about prediction, predicting the future, like I already mentioned, but it is about exploring different possible futures alongside the opportunities and challenges they may present, so that ultimately it helps us to act in the present and even shape the future. And I usually introduce it like this. So foresight uses a combination of diverse streams of evidence, also diverse expertise in a collaborative way, includes some creativity to really make sense of future changes. And we do that by first identifying which changes are coming our way, interpreting their impacts, then imagining how they may develop towards the future, and then very important to act on those insights. So foresight is really the start of an intervention. I must also say that foresight has many different methods. It's not one method, so it's a combination of methods. I won't go through this, but just keep in mind that it's not just one thing that you do. But what does summarize foresight then? It's a combination of forward-looking methods that are all applied in a structured way. And if we look at this very simplified model from going to the past, to the present, to the future, that is true for a few things, like things we call megatrends. Those are big trends that are already happening in the world and are likely to continue in the same direction in the years to come. Think about urbanization and climate change, for example. And this we use as a starting point often for foresight activities. But for many other things, there is much more uncertainty. And of course, you can do a projection where you use data, basically data from the past, because there's no data from the future. But there are two problems with this. One is that you have to assume that the past is something like the future, which we know is actually not true. And the other thing is, if you go as far as 2040, then at some point your uncertainty becomes so big that your projections basically don't make sense anymore. So with foresight, we try to expand our view to take into account also other futures, the probable, plausible, and possible futures, including more uncertainty. And now we're talking about futures in plural. But also that is a too limited model, because we also all have our different pasts, both individuals and organizations, which means we bring our own diverse expertise and knowledge, which is a good thing, but also our biases and blind spots. And that is something we try to mitigate, because what some expert may consider a completely plausible future, somebody else may consider unthinkable or preposterous, and that's exactly the kind of blind spots we try to avoid. So with Foresight, we try to use this collective intelligence in a structured way. That's basically how to summarize it. So I already mentioned that Foresight is really much about sense making of future changes, and you can do that through a sort of an analysis, impact analysis at the start. So future changes that have likely to have a high impact, and you kind of know what it will look like, that impact. These are megatrends I already briefly introduced, and these ones should be on your radar to prepare already. If they have a low impact, then you can park them as background facts and sort of ignore them. If they have a low impact but a high uncertainty, these are the ones you cannot ignore, because this is the quadrant where the surprises come from. So we usually track them as weak signals in horizon scanning. But I must say the bulk of the work in ECDC, in Foresight, is about the critical uncertainty. So things that have a high impact and a high uncertainty. And usually how you explore these is through scenarios. And a very easy, common way to build scenarios, you take two extremes of one critical uncertainty and another critical uncertainty, two extremes. And then you already have 4 scenarios that you can explore. So as an example, for the health system, you could consider public funding versus privatized funding, and bottom-up governance versus top-down governance. And then you already have 4 very different scenarios that you can explore the implications for your organization on. And usually we give them some fancy titles. So, and these are then scenarios that you can explore. Scenarios are not predictions, again, very important, but they are images of possible futures that you can mentally place yourself into. So it's a tool to more holistically prepare yourself for a range of possible conditions that you as an organization or person may be asked to operate in the future. And that's how that's why scenarios are such a valuable goal. But sometimes the reality is a little bit more complicated or complex even, and that's the case for public health, where we actually identified 10 critical uncertainties at least, and they're also quite wide-ranging. So we're thinking about inequalities, climate change, ways to use data, and pressure on natural resource and ecologies, just to name a few. On top of that, they're also heavily interconnected, so they don't develop in a vacuum. And we actually found that climate change and natural pressure on resources and ecologies, migration and inequalities are heavily interconnected with all the other drivers, meaning that they cross-influence each other. So to make sense of that high complexity, we made scenarios in a more complicated way, where we assessed how different drivers may develop towards the future. So there are future trajectories, possible trajectories. We grouped different driver trajectories that are more or less consistent with each other, and that formed the basis of our scenarios. But then we ended up with many different scenarios. I think we had about 14, which is way too much. So we tried to scope them down by merging contextual scenarios, which had sort of similar situational implications. We're thinking about the landscape of infectious disease threats, governance systems, and operating conditions for public health. And then finally, we were able to scale it down to only 6 scenarios. So these are the 6 threat scenarios we defined for 2040. They are published online, so I won't go through them in detail. And importantly, again, these are not predictions, but they are different possible images of possible futures, and cover the range of different possible driver trajectories. So for each of these scenarios, we then identified what would an effective ECDC look like in each scenario, called future attributes. From there, we did a backcasting. So assuming that this is where we want to be as an organization to be ready for these scenarios, what kind of steps and actions do we have to take to get there in the coming years? And with those actions, we identified 96 strategic actions to take. We then stress tested them to different possible future conditions through wind tunneling to make sure that they still hold up in different future conditions. That yielded quite a lot of action still, which we cluster in 5 different areas of work. Again, I won't go into detail because I won't have the time, but you can find them online. And this is really to help shape our own operations and strategy in ECDC. So just to recap, how have we in ECDC used strategic foresight? Well, we started with identifying megatrends and the changes they bring to us in the future, identify the underlying drivers of change, so those are underlying driving forces to the megatrends, assess their impact, uncertainties, and implications for our mission and operations. Then we imagined how these different drivers may develop towards 2040, and bringing them together, we formulated 6 different scenarios, which are worldviews, possible worlds we may be asked to operate in 2040. Then we did a backcasting to act on these, find out which kind of actions we have to take to be ready, wind tunnel these actions to make sure they're future proof. And then now we're in the process of road mapping these to really implement them in strategic planning. And if I have a little bit more time, I can introduce 2 more very brief methods in Foresight that you can often hear. So one is horizon scanning for weak signals. I already briefly mentioned at the start. Basically, that means you pick up some signals in the present. By themselves, they are kind of meaningless, but if you put them together in a structured way, you can actually see that it's the start of an emerging trend or issue. So you can already actively prepare for threats and opportunities for them. So that is horizon scanning. Often what is also called horizon scanning, but a nicer word is operation environment scanning or PESTEL analysis, is where you scan your working environment or operating environment for different political, economic, social, technological, legal, environment, or value developments, and then you already proactively start to prepare for those threats and opportunities. So this is not something we did in our work, but it is something you often hear in Foresight. So I just wanted to bring that to you before I close. So thank you. You can find the report of this work. It's a public summarizing report. You can find it online with more information. And I'll stop here and hand over back to Paul.
Thank you, and I always love both your slides, but also your ability to describe simply and clearly a complex set of things in a very easy, digestible way. So I'm always very impressed hearing you present the ECDC's work, and really also how ECDC is really, I guess, 10 years ago wasn't working this area, and now how much you've done in the last since you've been there. I'm going to move on. If you have any questions on any of the presentations, please put them in the chat. We'll try and get to them at the end. I'm going to turn now to Claudia Palczak, a former colleague of mine from the European Union's drug agencies, and she's going to review the activities EUDA has done over the last nearly 5 to 10 years, I think, in terms of developing, integrating foresights into their work. Claudia, over to you.
Thank you, Paul. Is my presentation working? Yeah?
Yes, it's clear and we can see it. Thank you.
Super. Thank you very much. Good afternoon and good morning for Lisbon. It's 7 o'clock, but still I'm very excited to be here and to share the EUDA's experience in applying foresight in the drugs field. In those 12 minutes, I will try briefly to tell you who we are, how we use foresight, and what are our current projects and challenges ahead as well. So first of all, about our agencies, 2 sentences. We are European Union Drugs Agency. We provide evidence base for policy and practice in the EU in the drugs field. And we are addressing both sides of the coin, demand and supply reduction, which really reflects the balanced approach of the EU drug policy. We are very much data-driven and science-based organization. Before I will talk about our experience with foresight, a few words about what Paul was saying at the beginning. I think we are very proud and privileged to have a really well-developed foresight ecosystem at the European level. We have annual strategic foresight reports that are prepared by the Commission. We have also Joint Research Center, which is a research arm of the European Commission with a competence center on foresight. And they are regularly publishing and preparing different types of methods and tools that can be applied in different policy domains. And then we have experience of the governments as well. Some of the examples I can give is Germany or Finland, where really foresight is strongly embedded in policymaking and research. So what we have seen in Europe and what Paul was saying as well, we see a strong diffusion of foresight in the public policy and research. And I think there is a growing recognition for foresight to be a response to complexity, uncertainty, and change. And this is what we see also among our so-called sister agency as ECDC, but also agencies working in the environmental area, foods area, or security. So if we move to the EUDA experience with foresight, we've started, around 2017. So it was a long time ago, but I have to admit as well that it was a relatively new area for us. So we took a step-by-step approach. We were looking at the methods and tools. We were reviewing the literature. We wanted to learn how others applied the foresight. And we were closely working with the Joint Research Center. And since the beginning, the idea was to use the foresight to inform the discussion about the new mandate of the EUDA. At that time, it was a monitoring agency, EMCDDA. And since the beginning, we really wanted to have a capacity building component, not only internally to really understand how foresight can be useful for our organization, but also how we can build capacity among our stakeholders. And there were a few other principles such as co-creation and really being impactful. So design the foresight for specific objectives. So let me focus on the first one, and it's very similar to what Herjon was presenting, because our first exercise was with the implementation of the fundamentals of foresight, which is the horizon scanning. So really 360-degree overview of trends, events, weak signals that are impacting or may impact in the future the drugs area. What we used was this mega trends analysis. So we were looking at the external world, what is happening, what is changing, and then we were zooming in into the field of the drugs. What you can see here, because we have the mega trends toolbox that is prepared by the Joint Research Center. They are basically on a regular basis collecting informations behind different megatrends and define them as those that will be impacting Europe in the next decade. So out of the 15, in a very collaborative and consensual way, we've decided that the most impactful for the drugs area are in the identifying inequalities, population change, and here we talk about migration, aging, but also concentrations of people in big cities, shifts in health challenges, here we talk more about non-communicable diseases, technological change, environmental degradation. And then we went into the drugs field and we were looking what we see is changing. We did also a pestle analysis, as Herjon was saying, so we were looking at the societal, technological, economic, environmental, and political issues. And we've also identified 4 big shifts that we see in the drugs area: shifts in drug policies and laws, shifts in discourse on addictions, shifts in drug markets, and shifts in services. And what we did later was to really look at what it means for the work of the EUDA and the member states. So we were really looking at what it means for the monitoring system by 2030 in view of this new information environment and new information needs. And there is a report, so I'm not going into details, which is available on our website. We did this, we reviewed then the horizon scanning recently, and we added 2 new features. One is AI, which I think it's not a surprise, but also geopolitical situation. And that leads me to something else which is important, and I will conclude on that in my presentation, that foresight is something that you don't do once and you leave the product as such. Is a really continuous approach, and you have to revisit the findings of your work on a regular basis. But similarly to ECDC, we use the findings of the horizon scanning to develop scenarios. So we really wanted to build narratives about the future and have a space for thinking about alternative developments. So we were asking questions such as, what are the possible alternative developments in the global and the European drug situation? what are the implications for the drug monitoring, and how we should be better prepared. Herion mentioned different methods of building the scenarios. We came up with 3 scenarios, and we used so-called morphological box. So we were looking at the big drivers of change, and we were building plausible scenarios. It's a quite transparent way of building scenarios, so we can really see what we've came up with, and there are many other options you can do that. So probably people can come up with another 3 or 4 scenarios based on our list of trends. But the horizon scanning results were not used only to build the scenarios, but we also used the insight to pilot Delphi study to define the EU research priorities. So basically, based on our horizon scanning work, we've defined 25 diseases. And together with a group of scientists, we were measuring the impact and time to maturity. And we were selecting the most emerging areas for research at the European level. I was saying at the beginning that we had the core principles. One of them was participatory approach. I didn't mention that before, but the horizon scanning really involved around 300 people in different ways, either participating in workshops, Delphi methods, or consultation work. So it was a really big group of people, and they were coming from different areas. And also we had a clear objective in mind. I told you when we did the horizon scanning and scenarios initially, it was to inform the EU mandate of the EUDA, but also at that time the countries were developing EU strategy 21-25. And actually we've organized a specific megatrends workshop for the policymakers. And there was an immediate reaction in the sense that Foresight and the results of Foresight were reflected in the EU drug strategy. And very recently in March this year, we organized a meeting of the national drug coordinators. So those from 27 EU member states that are responsible for creating the policies and coordinating its implementation. We've tested our 3 scenarios by stress testing the current strategy, EU strategy, and building some consideration for the upcoming strategy, because the European Union is now discussing the new EU drug strategy. So we had a very practical way of applying Foresight to think about policy responses. And then about the capacity building, we saw that people were starting with the Foresight in a very, I would say, cautious way. They didn't know what Foresight is, but once we took them on the journey, there was a big request for repeating these exercises at the national level or even at the institutional level. So we decided to build toolkits and to really explain to people how to work with these approaches in the drugs field. So we've published one on how to work with the megatrends, and we will be publishing soon on how to work with the framework scenarios that we've developed. And we still are using the results of the Foresight to inform the EU dialogue on research. Twice a year, we have a dialogue with the member states on what are the EU needs in this area. And we find the results of the Foresight work to be particularly useful. Then a few words about our current work, what we are doing. We didn't stop, actually, we had an appetite even to do more. And we decided to go from this a bit more generic level of mega trends and big changes to more deep dives. And we've selected 2 areas of work. They were very much driven by what we saw in the horizon scanning, but also with the needs at the EU level. So for the first time, we will be implementing a technology foresight. There are special methods which allow you to map and assess the challenges related to the emerging technologies. We will be scanning the whole area. So we will be looking at technologies and innovative methods and approaches in the whole spectrum. So from drug production, trafficking, distribution, to health responses and monitoring and research. It's a big project. It will take around 1.5 years. And we are really looking at assessing the technological readiness levels, so really how close some of the technologies are reaching the markets, but we will be also reviewing patent registries. And the idea, again, is to inform the research agenda, because we see that the EU level, a lot of funds goes into the security area, and particularly to the technology-oriented research. And then we are developing, and we are actually in the middle of developing a deep dive on synthetic drugs, really with the idea to increase EU resilience to possible developments in the future availability of the synthetic drugs in Europe. And this is a very, I would say, standard approach Herion was showing you. So we do the horizon scanning, we will be developing scenarios, and we will be strategizing. Just to give you a bit of a flavor what we do, because as I said, we are in the middle, we've already collected around 180 insights. So weak signals, drivers, wildcards. We've narrowed them down to 90. We have around 30 projections about the future, and we also narrowed them down to the 4 scenarios. So we are now actually working on reshaping the scenarios, looking at the implications, and having the final workshop in September when we will be doing a road mapping. One more important aspect that we are working on, we saw that we are collecting a lot of insights, and as Herion was saying, there is a lot of noise happening and you need to make sense out of it. So we were wondering, how are we going to collect all the insights coming from these different projects? And we are now testing a platform, Foresight platform, that is actually available and run by a private company, but it really facilitates the whole process from scanning to sense making to consensus building exercises. And obviously in these days, it's AI facilitated. So we are testing it and we will see if we are going to use it regularly in the future. So my final slides may be about the lessons learned from our perspective. I think there is a growing understanding about foresight work, usefulness of foresight work in our agency, and making our work and our approach more agile and forward-looking. As I mentioned before, it really is a continuous and co-creative process. So we have to regularly review what we are doing and make a shared sense making. When we were developing the scenarios, the first 3 scenarios, and the last one of the scenarios was considered as doomsday or really very negative. When we were discussing it now with the national drug coordinators 1 year later, we see that it's actually a reality now. So I think it was an eye-opening experience as well, that you have to do it regularly and refine it. I think to understand that process is sometimes the product. I think it's really important to take people on this immersive experience. We are very curious in looking at different tools and methods, and we are developing a repository of tools and methods. We talked about the basic ones, but I've mentioned as well technology foresight. I know that the Joint Research Center is now working on new ones that will allow you to assess risks. It's definitely a catalyst of activities by stakeholders, and you will hear Brian from Ireland, inspired by our work, but we have many other people coming and asking for repeating these exercises at the national and institutional level. And then design for impact. We are a small agency, so we really have to design this in a very impactful way. And then challenges, managing expectations. We said how fantastic the tool and approach is, but obviously it has its shortcomings as well. And we have to explain to people what futures and foresight does and where there are limits. And then we have to keep the creative spirit. So we are thinking, for example, now about developing games for policymaking, but also I think it's important to develop a foresight mindset. People feel a bit of a discomfort with this speculative way of working, especially when you are coming from epidemiology or public health. And there is a growing willingness of joint action. And actually, for the first time, 13 EU agencies coming from environment to security to drugs, we are doing a joint horizon scanning focusing on One Health. And let me finish by saying that I think the value we see is that foresight allows you to be active and really to shape the future. So it's not something given, but something you can influence. And I would like to thank you. And also with my presentation, I would like to acknowledge the role of Paul, who at this time of starting with our work with Foresight was really leading our work and guiding our work in this area. Thank you very much.
Thank you, Claudia. That's very kind. But I love the comment you made there about process being also the product, because I think that's something that struck me across certainly the EDU journey, how it's doing the things that have actually produced the value. And also for these exercises, very speculative exercises, how impactful they've been in terms of actually concretely influencing the new EU drug strategy, but also things like prioritization in the research area, and now moving to these some more technological deep dive exercises. So thank you for that. And so now we've had 2 EU level presentations, and Claudia said some of this work, I think people get enthusiastic. It's been taken on at the national level. So I'd now like to give the floor to Brian Galvin, who's head of the Irish National Focal Point. And Ireland has, I think, a rich tradition. They've done things like of innovative policy development activities. I know in terms of citizens' assemblies, another example of that. So, Brian, can you tell us how these methods have been used in Ireland, please? We can't quite hear you. Can you check your sound?
Yeah, okay.
We can hear you now. That's good.
Okay, very good. Okay, thanks. Okay, thanks very much, Paul, and thanks for the invitation today. I think we heard from Claudia and Haran that the ideas of Foresight and Foresight work is very strong at the EU level. The situation is not as advanced at member state, at national level. We have countries like Finland and the Netherlands that are strong. I know in Ireland, in the public sector, there is no Foresight work at all. So I suppose it's a bit more it's more of a challenge at the national level, and it's really important to have the support of agencies like you to help us in this. A brief introduction: I'm head of the Irish Focal Point. We do the usual routine monitoring and reporting and research work. We do a lot of commission work for our Department of Health and early warning. And knowledge dissemination and evidence practice work is a key part of our work, and Foresight is a part of that. Today I'd like to go through some of the events that we've organised with stakeholders in Ireland. The reason we did this was to introduce the concept of Foresight to people who didn't know much about it, who hadn't heard about it, and give them a chance to consider how it might be aligned or integrated into planning in areas like early warning and prevention. We're also involved in an EU-sponsored project called Drug Prep. There was a bigger scale and a longer time frame. I was very interested in itself. And I've finally like to look at our efforts to, I suppose, persuade policymakers that it's worth considering Foresight and using Foresight. As I said, it's not well established in the public sector in Ireland, so there's a lot of educational and persuasive work to do. I regard to stakeholder engagement, I'm going to look at two events that we organised in Ireland. They're both at our annual stakeholders conference. It's called the National Drugs Forum. One in 2021 that was held online. It was during COVID, so it was challenging, but it was a good start with Foresight, and a more ambitious one at our National Drugs Forum in 2023. So the overall objective of the Megatrends workshop in 2021 was to provide participants with an understanding of what Foresight is and why it's important, as well as an understanding of the wider changes in the environment that could have implications for drugs and the responses to drugs over the next 10 to 15 years. And now we went in the previous two presentations, you went through a lot of work on megatrends, so you get the idea of megatrends. So I won't go through that. But in the workshop, the participants prioritize megatrends according to their potential impact on the future of drugs and responses to the changing situation. One of the more useful outcomes of doing this particular workshop is that we were able to develop a community of practice, a group of people including policymakers, people working in NGOs and research who were interested in Foresight and prepared to work with us on events over the next year. So it was a good start in that sense. It was an introduction, challenging because it was online during COVID, but at least we had an outcome that we could build on after that. The next Foresight workshop that we had was during the 2021 Drugs Forum, and we organised an areas development workshop, and that's Anna from a Polish Foresight company was brilliant, and she was brilliant at that day. And we had the people from the community of practice that I mentioned, and they facilitated the groups working at the workshop. So the overall theme was the problem of substance use among young people in Ireland in 2040, and the idea was to identify threats and recommendations, responses. The organisers used the Dirk van Winkle technique, and that's where participants are asked to imagine they're just walking from a sleep of several years and must think of questions that they need to ask to understand the world that they're in a bit better. And each question has a yes or no answer, and it reveals aspects about what the person who's answering the question is uncertain about. So we prepared for this by doing a survey prior to the actual conference itself. So we've got a lot of work done before we met. So that was quite handy. There were a number of uncertainties identified through that work, and they were organised into 14 clusters of uncertainty. And then 2 extreme outcomes were assigned to each uncertainty cluster, and out of that a quadrant was made. There's the list of clusters of uncertainty in the left column there, and extremes of each one. And then 9 groups of people looked at 2 of these clusters of uncertainty and did their own quadrants. I'll give you a brief look at the intense work that went on at that workshop. So a scenarios development workshop, it's a useful way to facilitate the generation of new ideas. While our workshop was brief and a limited exercise in strategic foresight, it confirmed that there was a real interest and enthusiasm among stakeholders in engaging in this work, an agreement on the worth of foresight and the relevance of foresight concepts to prepare for uncertainty in a complex and challenging area. The next project to talk about is drug prep. That was a European Commission funded project. It was funded by DG Just, and it was led by Trimbos in the Netherlands. There were 6 countries involved in that. So each country completed a situation report and then had a horizon scanning exercise. Horizon scanning is a bit like doing a systematic review or a scoping review. There's a structured search, extraction of data from the literature turned, and it's organised by steep headings and analysis added to that. So it's quite labour intensive. It's a lot more work involved than in the workshops we did, but it also involves consultation with local stakeholders. And again, I was able to work with our community of practice who were able to order the themes in order of importance to them. So any foresight exercise, any thorough foresight exercise will need a horizon scan, but it is it's quite resource heavy, and I think we really needed the support of a European project to do that. And there are the different stages involved in the drug prep project. It was run between 2023 and 2024, and there are a number of reports available on that. It was I suppose an educational exercise more than anything else, because none of us were pretty far advanced in foresight thinking and methodology at the time, so it was a good opportunity to learn and make sense of it. So I suppose like the policy innovation, and it's going to require persuasion and demonstration of the value of foresight if we're going to get it embedded in policy. And one way to go about that is to show how it can increase stakeholder engagement, and people will become involved in it and contribute ideas to policy and thinking about the future. And the trickier part is to demonstrate to policymakers the epistemic potential of foresight and how it aligns with other perspectives. That's a philosophical concern, I suppose, but it's a policy challenge as well. Okay, thanks very much.
Thanks, Brian, for taking us through again how you've used foresights and futures in the Irish setting, and again reminding us it's actually part of the value of this is the opportunity it provides through engagements with lots of diverse audiences and stakeholder groups. And I know that part of the discussions have been going on in the European thing is how actually do you make foresights much more inclusive in terms of involving affected communities and people with lived experience and all those methods. And I think there's another debate to be had on that. But we've heard a lot about the EU, and we're in Australia. And I know that Alison has, she's had some experience, I know, in the past with foresight studies, something I was involved with a long time ago too. Alison, can you, from what you've heard, what do you think are there lessons for Australia? Are there things there we should be thinking about over here, or is it just sort of crazy stuff being at the EU level? What do you think?
Thank you very much, Paul, and thank you to the presenters. I'm not sure if I need to change my. Can you see me all right?
Perfect, can hear you perfectly.
Excellent. Okay. Can I acknowledge that I'm on stolen lands, the lands of the Bedegal people? I have a very mixed set of reactions around foresight, perhaps coming from a sort of a pragmatic Australian perspective. I bring caution, but I also bring quite a bit of enthusiasm. The first thing to say is that Australia has not embraced foresight. I think Claudia used the word the foresight ecosystem in Europe. So we don't have a foresight ecosystem in Australia in relation to drugs. There is foresight activity in Australia. The CSIRO is engaged in it. The University of Sydney has a unit. Swinburne University of Technology had a centre in foresight. And in fact, the Australian Public Service Commission has a section on their website with foresight methods. So it's around, but it hasn't permeated in any way our research or policy making environment. I was involved in a foresight exercise 20 years ago, the Drug Futures from the UK, and I still have the documents associated with it. they engaged in a participatory process using some of the methods that have already been described, and they came up with 4 different stories about plausible futures. This was 20 years ago, 25 years ago. And I won't read them out to you, these 4 plausible futures, but I have gone back and had a look at how they fit with where we are today. And I mean, the remarkable thing that's missing is cannabis legalization. And the thing that's been overshot, I think, is the role of technology. Now, foresight is not about predicting the future, and the scenarios are to make use of better planning in the now. But still, I think there are lessons for us to think about what are the scenarios that have been developed and where were the kind of gaps or the things that we overshot on, if you like. How to get foresight happening in a meaningful way in Australia, and it might speak to Simon Lenton's question in the chat. I think right now we have a very reactive policy-making environment in Australia, and what foresight methods offer is the opportunity for a more reactive, proactive policy-making environment. But how do you get drugs on the agenda for anyone to be reactive about and to want to participate in a forward-thinking exercise in order to do things better in the present? And I think that's worth some conversation and discussion. I think my enthusiasm for this as a method is linked to the participation component and elevating voices that don't get a voice, in addition to the kind of collaborative and multidisciplinary processes. So the notion of megatrends, which has been talked about, so often in drugs, we're incredibly myopic about the drug policy issues before us or the drug-related harm issues, and we're not thinking about climate change. We're not thinking about migration. We're not thinking about poverty or privatisation of healthcare. So I think there's enormous value in bringing all of these other ways of thinking using a structured method. Some of my cynicism is about some of the methods, you know, backcasting, wind tunnelling, stress testing, the pestle analysis, visioning. I mean, it's got the ring of consultants in suits. And we might need to think about how we sell it to Australia, because Australia is deeply cynical about consultants in suits, right? So we might need to work something out to make foresight more Australian, maybe. And then my last comment is really, how do we know it makes a difference? And I think this is a fundamental concern for someone as a researcher like myself. So obviously, if you want to evaluate an investment in foresight, you want to know whether we did manage the future better and we were better prepared. And yet the essence of foresight is uncertainty and is the unexpected, the black swan. So I can't quite get my head around, did we manage the future better when we know it's incredibly uncertain? And that makes me think maybe the biggest value in foresight is what Claudia mentioned, which is that the process is actually the product. And the opportunity, for example, in Australia to bring together a whole bunch of people to think with creative methods would set us in, I think, a much better position than we're in right now to form better drug policy. Thank you very much, Paul.
Yeah, thank you, Alice. Always informed and well-formed comments. I'm going to turn to the speakers, ask them to respond a little bit, and also to Simon's question, because I think the two are linked. And I know certainly my experience with some of these methods, it's simply making the fact that people's attitudes become more open and they become less myopic in their views. And that's something that is an ongoing accomplishment, achievement, as opposed to something where we a very concrete thing. But can I ask each of our speakers to reflect briefly on that question about, one is how did you overcome, or how did you stakeholder engagement, and did you have resistance to that? And also, where do you see the impacts of this, the sort of tangible and intangible impacts of this in terms of your organizational work? I don't know who would like to start. Gejong, do you want to come in, and then Claudia, Brian, or anyone?
Yeah, sure. I don't think the overcoming that challenge has that we're there yet. I mean, there's still the same amount of resistance, and you have to choose your words carefully. I think with more senior decision makers, they're always interested in the impact it will have, which of course you cannot really show. And then process benefits is usually a fairly weak argument. So I think that's a challenge there. But if you work with experts, really scientific experts, they are very allergic to these words. Well, Foresight in general already thinking it's a buzzword. So you have to use things like anticipation and preparedness and things like that. So that is already, I think, a very big thing. So yeah, no, it doesn't come that easy. But I think when people have been involved in a Foresight exercise that is done well, and there are a lot of bad consultants out there, so you have to be careful, then usually they're kind of hooked and will try to make the time for it. Because to me, that is the most important benefit of Foresight. It is mainly making that dedicated space and time, and also having a purpose to bring people with different perspectives together. Forget a little bit about the present reality that is, with the interest from different angles, and really think about, okay, where could we go to the future, or how can we prepare for something that is a bit further away from our current agendas? And then I think that is mainly the benefit that I've been seeing in any Foresight exercise I've been participating in.
Let me build on Herjon's. I think we have a very similar experience, this a bit of caution when we suggest Foresight, and the same exact experience when people are going and they see it's done in a very systematic and methodological way. It's not like we are having a group of people and everyone shares what they have in their mind, though we know, and we know that from the meetings as well, that each of us has a scenario in its own head. So I think people are really challenged. We are reframing the way they are thinking, and I think this is important. Also, you're talking about the black swans, reality shows it's not easy. COVID, if you look at the Foresight, war in Ukraine 2 days before the war started, there were still people saying it's impossible. So, it's the way I think our nature and mind deals with accepting that the disruption can happen and how often it happens, and you are talking about the cannabis policy, but if you think about drug area, even at the European level, in the last 15 years, how much it has changed as well, or 20. It's, probably it was unimaginable for people, but still, I think the key is really to bring people from diverse areas, and they can shake you a bit, and they can open your mind. We see that about the technology now. We have a technology Foresight that we are doing, and there is this tendency that we rely on people who are our stakeholders, immediate stakeholders, and we are saying, no, this is really about those who know what technology is, and they can explain to the drug people what it can bring to the area. So it's a dialogue a bit, but you need to have this diverse perspective. But I would say to understand that it's a systematic process and we can document it. So it's really well organized. And I agree with Herjon. You have to have someone to guide you and to lead you. It's not like you come up, I'll do it. It's really to have someone who will be mentoring you and explaining you how the process will be organized.
Brian, it'll be the last minute of our meeting, but do you want to?
I think at the stakeholder level, it was quite easy to engage people. People were actually quite curious and are willing to have a bit of fun with it as well. I think at the policy level, it's a lot more challenging because it's an innovation. So any innovation in policy is going to take a lot of work and a lot of persuasion. So that's going to take years. It doesn't exist in Ireland, outside our little pocket. So a big challenge there, I'd say.
Well, I guess I get the last one, that which is, I mean, I think I'm amazed how impactful it's been given where we came from, actually, the EU level. And the other thing is sometimes it's the more scientifically minded, serious science who find it most challenging to actually address uncertainty, whilst at the same time, some of the policymakers are quite, actually, they are making policy for the future, and they're actually more open sometimes to some of the sort of, big open sky thinking. So anyway, I think it's been can I thank all the speakers? I'm thoroughly enjoying the webinar today. Can I thank all the audience for staying with us for so long? And I would just like to, my last duty is to put up the last slide to introduce the next webinar we'll be doing on the 20th of August, which will be on opiate overdose, evidence, experience, and emerging threats. So thank you very much, everyone.